Hello, everybody. My name is Dr. Mena Ramos. Wonderful to be a guest here at Quality Care and wonderful to be here in Nairobi. I am so excited to share a few words about the work that we do at Global Ultrasound Institute, as well as more on point of care ultrasound. But before I get into that, I want to give a little bit of background. I am a medical doctor by training, a family physician. And during my training in California in the United States, I had the very good fortune of having amazing mentors that taught me point of care ultrasound in my residency, um, well over 10 years ago now. And during that time, point of care ultrasound really transformed my medical practice. It allowed me to uh, get to a diagnosis much faster, have a better sense for why a patient had cough, trouble breathing, for example, or swelling in their legs, or pain in their abdomen, or pain in their shoulder. And these are just a few examples of common symptoms and complaints that when you have the capacity to do a point of care ultrasound, it can really give you much more real time insight to narrow down your differential diagnosis and make a better next decision for your patient. In addition to all of that, when I was learning point of care ultrasound and using it in my practice, something that really struck me was how much my patients really responded to being able to see in real time what was happening inside their own bodies. And it built instant connection and trust that I hadn't experienced with other forms of technology in medical practice. And so I became very passionate about how POCUS can not only uh, help you arrive at a better diagnosis faster and potentially save lives, save costs to the health system, and improve the overall quality of care. I was also very much drawn to how how much of a connection that being able to see in real time with ultrasound built, and the trust that was built with patients, and how the experience and the quality of care significantly improved. Um, so the Global Ultrasound Institute is a organization with a central mission to support and operationalize point of care ultrasound around the world in order to achieve measurable and positive healthcare outcomes. And we do that through a combination of things. Education and training is one very important component to that. Education and training that also includes longitudinal support through mentorship and quality assurance. So we review images. We also have developed a platform, an online platform for centralized learning for POCUS, for multiple specialties, family medicine, pediatrics, internal medicine, nursing, midwifery, basic obstetrics, and gynecology, just to name a few things. But we also developed ScanHub, which is an online platform accessible to learners around the world that allows for institutional tracking. So if you work within a, say, medical school or residency program or hospital-wide system, and you need to have data among learner performance and usage. And this is a platform that allows you to have visibility into learner performance, as well as a way to maintain quality over time through quality assurance. So you can share images and have those images reviewed by one of our trained faculty in point of care ultrasound. And we partner with many organizations where we work with several different device companies. We're device independent. We also work with have we have multiple institutional and academic partners to do for POCUS training, both in person and longitudinally. We also work with several different funders and have multiple public and private partnerships, because really our central mission is to promote, build awareness, and decrease the barriers to meaningful adoption of point-of-care ultrasound. And so with that, it's wonderful to be here with you all. Thank you for taking some of your afternoon to listen in, and I will pass it on. Thank you. And once again, I'm Dr. Mena Ramos.
Right. So virtual claps for Dr. Mena. Thank you very much, Dr. Mena, for just giving us an idea of what Global Ultrasound Institute is and what GASI does. Yes, so the focus of today, the focus is, of course, POCUS. I know many of us have heard of POCUS before. We have shared a few links just in the chat, which you can have a look at, and yes, just get a better idea of what the GASI ecosystem is. Yeah, so before we start, as is our tradition, for those of us who are possibly joining us for the first time, we usually do just a brief introduction, and then we'll jump into today's CME. My name is Edgar, Administrator at Quality Care. Today's presenter will be Etna, POCUS instructor. She'll take us through the first POCUS CME. We have a huge team. We also have other POCUS instructors with GASI. If they get a chance, they'll introduce themselves. This is where we are based. We are based at 5th Avenue Office Suites, 8th floor at Quality Care. Life is Life campaign. We still continue strong, sharing knowledge and skills when it comes to emergency care. Now for POCUS, we have a POCUS training with GASI, which will happen first week of February. It's not too late to join. You still have some time to read. So 2 weeks to first week of February. If you're very interested, you've been touched by what Dr. Mena has said, then we hope you will join us for this POCUS training. Part of POCUS training, of course, includes this is vascular access. So when you come for the POCUS training, we will do this. You can see the needle entering, and voila, you have access. So you don't have to traumatize your patients, or as you're doing more advanced procedures, then all you need is just your probe, ultrasound gel, tablet, /smartphone, and yes, you see what's happening inside of your patient. Here we have lung ultrasound happening, high quality CPR in a different format, trauma life support, our partnerships, of course, including GASI, yes, etc., etc. Now, as part of the POCUS training, we will be focusing on focused assessment with sonography and trauma. We train you on how to look for free fluid inside of the patient. We'll be focusing on cardiac ultrasound, lung ultrasound, and vascular access. You can see the deadline for payment was 5th January. Reason for that is because you do need some time to read. When you come and do this POCUS training, it's very hands-on. So we have at least 20 patients who you scan, and by the time you do finish the training, then you have a very good idea and appreciation of different patients' anatomy. So in case you're interested with POCUS, we still welcome you so much to attend the training that we do have first week of February. This is where we're located. I'm happy to say that the process for KMPDC has finished. We have gotten our license for 2026. So this means that we will start issuing CPD points for medical officers starting Monday next week. So yes, in case you have attended all of these CMEs, you're very lucky. Specifically for medical officers, now you should have accumulated 30 CPD points. Nursing officers, you should have 15 CPD points, and clinical officers should have 30 CPD points. So medical officers, you will receive your CPD points on Monday. Please get in touch via DM as per usual with your full names, your Zoom username, and payment confirmation as well. Yes, so in order to claim the CPD points, you must have met all these requirements. I hope we remember, but I know by now we do all remember. This is our website. This is our email address and our Facebook page. We also request that you like us over there on the social media. We are Quality Care Kenya on TikTok, on Facebook, on LinkedIn. And also we request that you also follow and like Global Ultrasound Institute by the same name on Facebook, TikTok, Instagram, and LinkedIn as well. Having said that, welcome you a lot to today's session. We'll now jump into today's CME, which is focus assessment with sonography in trauma. I would urge you to come and do the POCUS training because POCUS is a really hands-on kind of skill. We can get a bit of appreciation from this CME, but really the best way to learn is by doing. Yeah, but yes, welcome to this CME. And then let me welcome Edna to take over.
Okay, good afternoon. My name is Edna. I'm a part of quality care team. I'm a trainer with quality care. I also train other things. I'm a POCUS instructor with quality care. And welcome to today's CME, where we are going to focus mainly on first exam. So today's CME is on POCUS. And if you've not heard, POCUS is a point of care ultrasound. And a point of care ultrasound is quite important, especially in the emergency department. Now, point of care ultrasound has its benefits. The first benefits that we have with the point of care ultrasound is first, it's fast, very fast, and we're going to do it bedside, and it saves a lot of time. When we have an emergency, if it's a critical patient, trauma patient, when we want to answer questions immediately, questions like if there's any free fluid, whether there's a heart contractility, how is the contractility, whether we have a pneumothorax, if we have hemothorax, Other things like if the patient has aortic aneurysm, these are things that we will be able to answer when we are using our point of care ultrasound at bedside. So it's really important to learn how to do POCUS. So for today's focus is FAST, and FAST is first in full is focused assessment with sonography for trauma. So now this one, we are doing it in the face of trauma. And mostly we do our FAST in when we are doing our primary assessments. Once there's a patient who comes, a trauma patient, a patient where we are suspecting a blunt abdominal injury, or there's unexplained hypotension, a patient who is bleeding, who had high intense injury. These are patients that when you're doing your primary survey at circulation, you want to quickly do your first exam. And when we're doing our first exam, this is something that can take up to 5 minutes or less. So it will quickly answer questions. And what we are trying to do with the first exam is to answer a binary question, yes or no. We just want to know whether there is any free fluid in the abdomen, yes or no. And we have fast and extended fast. For today, we are going to talk about fast. So for fast ultrasound, we have four places where we check. The first thing where we check the abdomen, where we are checking the right upper quadrant. We check the right upper quadrant, we check the left upper quadrant, we check the pelvis, and we also check the heart or the subxiphoid. So we are checking whether there's any free fluid in the quadrants in the abdomen, the right upper quadrants, the left upper quadrants, the pelvis, or the heart, around the heart. Now, in the abdomen, we start with the right upper quadrant. And when we are checking the right upper quadrant, that is where you want to start your ultrasound, because that's where mostly fluid is going to accumulate. When we are doing our ultrasound, the first thing we want to think about is depth, and that will come from our machine. You want to start with a high depth, then you want to check your orientation. And for orientation, that is where your probe marker is facing. And then you want now to check whether you have gel. Gel is what you're going to be using as your medium to be able to acquire the image. Once you've done that, the next thing now you want to do is your landmark. So we have the external landmark and the internal landmark. When we are doing the right upper quadrant or the quadrants, the first, the external landmark will be the posterior axillary line at the level of the xiphoid. So you want to locate the xiphoid process, and then you go down to the posterior axillary line. So you can start with the right upper quadrant. Once we've gone to our external landmark, now we want to look at the internal landmark. And the internal landmark is usually our kidney. So we do not want to interpret that image without seeing the internal landmark. Once you see your kidney, you also want to think about the relevant anatomy that you want to see. And in the right upper quadrant, you want to see the liver, you want to see the right kidney, you want to see the diaphragm. Then you are looking at the area of interest, and the area of interest is the area between for the right upper quadrant, the liver and the kidney, that interface. So we have the hepatorenal interface in the right upper quadrant. Once you've seen your area of interest, now you want to interrogate that area. So this is the right upper quadrant. You have your liver, you have your kidney. So once you're in the external landmark, the next thing you want to see is the internal landmark, which is the kidney. Then you've seen your relevant anatomy, where you have your liver, you have your kidney, and there's the interface. Now this is my area of interest. Once you have the area of interest, now you want to interrogate this area of interest. And how we interrogate this area of interest is by sweeping, a movement that we call sweeping, until we lose the kidney, just looking for free fluid. Now that takes us to how different, how things will look in the ultrasound. So different tissues will appear differently in the ultrasound machine, and that's something we call echogenicity. So in echogenicity, we have fluid, which will appear as black. That is something we call anechoic. Then we have something like bone, or a solid structure, stiff structure, which appears as white. This is hyperechoic. We have something like the liver, which appears gray, which is isoechoic. And we have hypoechoic, where it appears as dark gray, something like a clot. So once we have our interface here, what we are looking for is whether there's any free fluid between the liver and the kidney. And how we do it is by interrogating this area, by sweeping until we lose the kidney. So we are looking for any black that is here. That will be our free fluid. And that is in the right upper quadrant. Now, when you look at my image, we cannot see the tip of the liver. So once you have that, you want to slide until you see, towards the legs until you see the tip of the liver, and you also want to interrogate that area. Once you're done with the right upper quadrant, you're comfortable with the images that you've acquired, now you can move to the left upper quadrant. And for the left upper quadrant, again, your external landmark first, you're looking at you want to be at the posterior axillary line at the level of the xiphoid. Then your internal landmark is the kidney, and there is the kidney on the left side. Then relevant anatomy that you want to see, you want to see the spleen, you want to see the kidney, you want to see, this is the diaphragm, and this is the lung. Now, we are looking for any free fluid. Again, we said free fluid will look as black. So we are looking for any black region between the kidney and the spleen here. So once we have this, we want to interrogate this area. And how we interrogate it is by sweeping until we lose our kidney. Now, for the left upper quadrant, we also want to look at the area between the diaphragm and the spleen and above here. This is other places that fluid is going to accumulate. So these are also areas that we are going to look at in the left upper quadrant. Now, remember, we are just doing fast. If we do extended fast, we'll also be looking at the area above the diaphragm, at the lung, to see if we can see any free fluid. And now that one will be hemothorax if it's in the face of trauma. So this one will be pre-refusion or blood, that is hemothorax. For fast, we just want to see in the abdomen, so we check between the spleen and the kidney and the area below the diaphragm. That's for the left upper quadrant. Now, another region that we check for our first is the pelvis. And this is how we check the pelvis. And for pelvis, again, the patient should be in supine position. For pelvis, we do 2 views. And we start with the longitudinal view. Then we want to turn our probe 90 degrees, having the marker face the right, and check the transverse view. Again, what we are looking for, we just want to answer a binary question, whether there's any free fluid in the pelvic region. So we are looking for any anechoic region in the pelvis. Now, one thing you're going to notice about the pelvis is we are going to see the bladder, and the bladder as urine. So this means this part will be black. And what we are looking for is black. So we are looking for free fluid, which is uncontained fluid. So for uncontained fluid, the difference that you notice with that is in the bladder, the margins or the walls, they are regular. But for the uncontained fluid, which is free fluid, it's usually irregular. So as we look for these, we are looking for something that is irregular outside the bladder. So we have the female pelvis. This is how the female pelvis looks like. We have the bladder, we have the uterus, which is juxtaposition to the bladder. Then behind it, we have the rectum. So when we are looking at this view, first the external landmark, where we are going to place our probe, we place our probe just above the pubic bone, this area. This is where we are going to place our probe. We start with the longitudinal view. So our probe will be facing the head of the patient. Once we do that, we look for the internal landmark. And the internal landmark now will be the bladder. Just next to it in the longitudinal view will be the uterus. And we are looking for free fluid between the bladder and the uterus. So this region, this is where fluid is going to accumulate. And for females, between the rectum and this region that we call the pouch of Douglas. So this is where we are going to be looking for any uncontained fluid or free fluid, which is going to appear as black. Now, once we have a good image of the uterus next to the bladder, where a good image is, we are going to see the endometrial strip extending to the vaginal canal. Once we have such a good image, we want to sweep that area as we look for any free fluid until the bladder disappears. Once we are okay with the longitudinal view, we are going to look at the transverse view. And the transverse, what we are doing is, for the longitudinal, we are cutting across like this. For the transverse, we want to look at it in this plane, transverse plane. So again, we'll have our bladder, then the uterus will be just below it, then we'll have the rectum. So we'll be looking for free fluid between the bladder and the uterus, and between the uterus and the rectum at the pouch of Douglas. Again, when we have that, we want to interrogate to look for any free fluid. And this is what you're talking about. So this one is the longitudinal view. We can see this is the bladder, and it's black because we have urine, which is fluid. And we have our uterus here, extending like this. Then the rectum is down here. So we are looking for any free fluid here between the uterus and the bladder, and for any free fluid between the uterus and the rectum. So once we have this image, we want to sweep anteriorly and posteriorly as we look for any free fluid. We also have the male pelvis. For the male pelvis, we are also looking for any free fluid. For the male pelvis, we want to check any free fluid between the bladder and the prostate or the rectum. Free fluid accumulates somewhere there. And we also do two views, that is the longitudinal view, where we are cutting across in a longitudinal plane, or the transverse plane. When we do in a longitudinal plane, this is what we want to see. We want to see the bladder here and the prostate. We have the seminal vesicles here, and this is where free fluid accumulates in the male pelvis. Once we've done the longitudinal view, we can turn and check the transverse view and look for any uncontained fluid. This is a video of the female pelvis in the longitudinal view. So you're sweeping until you lose the bladder to look for any free fluid in the pelvic cavity. The last view we check in first is the subxiphoid, or where we are checking any free fluid in the pericardial cavity. And for this one, we want to check it at the xiphoid process. So our external landmark is the area between the umbilicus. We want to see the liver. And this is what we are using as our acoustic window or our internal landmark. Then once we have that, this is how we want to see our image. We want to see the liver, and we want to see the inferior pericardium of the heart to the point where it intercepts with the septum. This is our area of interest. So this is how our image will look like. This is the liver, the inferior pericardium, the point where it intercepts with the septum. So this is the area where we are looking for any free fluid. We are also looking at the left ventricle. So this is the right ventricle, the left ventricle, the left atrium, and the right atrium. We are looking at this area to look for any free fluid. So once we have this image, we want to interrogate the area of interest, which is this one. And we do so by sweeping until we lose the heart, so that we can see if there's any anechoic region at this area. Once we sweep, we want to sweep anteriorly, then posteriorly. As we do so, if there's any free fluid, it becomes bigger. So those are the main focus of FAST, the 4 views of FAST. I don't know whether there's any question. I want to welcome Sheila from Global Ultrasound Institute to come and say something. Welcome, Sheila.
Welcome to our review on point of care ultrasound. Good afternoon, everybody. My name is Sheila Masheti. I work with Global Ultrasound Institute. I help coordinate and organize POCUS activities within the region, and I'm glad to be here. Thank you so much, Dr. Edna. Thank you so much, Edgar, for organizing this CME. We are happy to be here with the team.
and we look forward to hosting many more point of care ultrasound training sessions together. I don't know if anyone of us have any questions. Feel free to put them in the chat. I had earlier on shared some of the contact details for Global Ultrasound Institute with a few links of where you can find more information in case you need. So feel free to, we are ready to take any questions you may have. So if you'd like to just probably raise your hand and mute your mic. Yes, then we can answer your questions. Thank you. As we wait for some of the questions that you may have, just a few repository of images and videos that are related to the topic of the day, point of care ultrasound, the first study to evaluate for free fluid, especially during trauma. So what is being displayed right now is a video showing a positive fast. We can see an echoic, yes, you can see an echoic ridge that indicates that this is a positive fast. So there is free fluid in this region on the left upper quadrant. And this is another one that is also positive. And we can also see the anechoic region. We can also see the lobe of the tip of the liver that indicates that there is free fluid within the abdomen. To differentiate between the free fluid and contained fluid is, of course, contained fluids will have well-defined margins. For this one, the margins are not defined. You can actually see some regions are irregular. So this is just to tell you that there's free fluid in this space. And all these images and videos are available on ScanHub. The link that I had shared earlier on, you can actually just log in and have a look. And this is also a positive fast study. It actually indicates both free fluid in the abdomen and free fluid in the lungs. We can see an echoic, so we can see the diaphragm, but we can also see free fluid on both sides of the diaphragm. So there's free fluid in the abdomen, there's free fluid in the lungs. Faith, I can see your question. You ask, the subxiphoid view only shows free fluid in the inferior pericardial region. What if there's fluid on other regions? Can that be viewed as well? So in the subxiphoid view, we are looking at the heart, and we are using the liver as an acoustic window. I'd like to just clarify if you're asking whether there's free fluid in the lungs, sorry, in the heart. So there's pericardial fluid. So one thing we need to understand is that when we are seeing when we're doing the subxiphoid view, we are visualizing the heart from the base, which is the most dependent region for accumulation of fluid. So that region, the pericardial, we call that the sign of 7. So where the inferior pericardium intersects with the intraventricular septum, that is the most dependent region for fluid to accumulate. And so that is the first place you'll see fluid. So the least amount of fluid will be able to be seen in that region. If there's more fluid, of course, the heart, and in cases where there's tamponade, of course, you'll see the heart kind of swimming inside fluid. And so, yes, to answer your question, Faith, if there's more free fluid in the lung, and even as you can see, whatever is being shown right now, you're able to pretty much see the whole heart and all the borders of the heart using this one view. So to answer your question is that yes, if there are there's free fluid in other regions in the heart, you will be able to see it using the subxiphoid view. Thank you very much. That's a very good question. If there are any other questions, please feel free to just raise your hand, unmute your mic, and we can interact. Yeah, so this is also, when you're assessing for free fluid, remember we have 3 places in the abdomen where fluid can accumulate. So we have the right upper quadrant, we have the left upper quadrant, and then we have the pelvis. So this is a female pelvis. And when we're assessing for fluid in the pelvic region, we use the bladder as an acoustic window. So here we can see the bladder very well defined. It has well-defined margins, and it's actually quite a full bladder. We can also see the uterus very well defined. We can see the endometrial stripe in the uterus, but we can also see free fluid. Remember the irregular margins and contained fluid. So we can see a stripe of free fluid right behind the uterus. And so this is also a positive fast, and it shows free fluid in the pelvic region. All right. Another demonstration of free fluid in the pelvic region. Remember, we use the bladder as an acoustic window. And sometimes when a patient comes in the emergency department, sometimes you do not have the time to feel the bladder, but sometimes it is very possible to actually see the uterus and make your assessment without that much of fluid. And so this is what we can see here. We cannot quite see a full bladder, but we can quite distinguish. We can see the uterus. It's clear at some point. Maybe we can play the video a bit slower or even pause there. So yeah, we can see the uterus. And we can see a stripe of free fluid. So the assessment of free fluid is actually very important, especially in the emergency situation, but also even for our patients. Like if you want to assess for ascites in a renal patient, if you want to assess for a ruptured ectopic pregnancy. So these are some of the use cases for the fast scan. So much as it is a fast scan that is used in the emergency in trauma, it is also applicable in other situations. And it can help you to quickly identify free fluid and institute management, even before we get a formal scan from the radiology department. Remember, the point of care ultrasound is an adjunct. It is complementary and does not actually replaces the need for a formal ultrasound. And it's also a complementary of your physical exam. And this is a typical free fluid in both the abdomen and the lung. So we can actually see a very, very big pocket of free fluid. A right upper quadrant free fluid again. I remember Dr. Edna also spoke about the E-FAST. So we have the FAST and also we have the E-FAST. So the FAST assesses for free fluid in the right upper quadrant, in the left upper quadrant, in the pelvic, and also the subxiphoid for the cardiac. But you can also, in the E-FAST, you'd also be able to assess for free fluid in the lungs. This is the right upper quadrant, and we can see a big pocket of free fluid. All right. Please post any other questions you may have on the chat. And we'd be happy to assist every one of us to get to a level of competency and to be able to practice your point of care ultrasound to improve patient care and to get faster questions, to answer faster, to quickly answer clinical questions that you may have to take care of your patients. We are one more time very glad to have you all with us today. Happy for quality care training to have organized for this CME. Please feel free to reach out to us if you need any questions answered. Thank you very much and enjoy the rest of your afternoon. So over to you, quality care trainers. Edgar, thank you.
All right. So thank you very much, Sheila, for that very nice presentation, and Edna as well. This brings us to the end of today's session. So just to mention once more, we'll be having just a minute. Yes, we'll be having this POCUS training first week of February. So we welcome you a lot to take part in this training. In case you are very much interested in learning the skill, personally, I feel it's the future of medicine. So instead of having to send your patient to Department X or Department Y, and you need to figure out what is happening inside of your patient post haste. You need to figure it out right now. Then POCUS tries to answer this question. So yes, as emergency care continues to improve here in Kenya, I strongly feel that POCUS has a very strong part to play in doing this. Santeni sana. We'll be having the next CME in the next 2 weeks. So that should be first week of February. To claim CPD points, it's the same steps. Share your Zoom username, share your cadre, whether you're a medical officer, nursing officer, clinical officer, and we will share the necessary CPDs. This is on Monday, not today, but on Monday. So I'll share just an email highlighting all of the steps, and then we'll start issuing the CPD points on Monday. Having said that, we thank you so much for taking part once more. Does anybody have any questions before we call it an afternoon? Or a CME? All right. So someone asked, do we do obstetric POCUS? Yes, we do obs. It's a more engaging training because this means that we have to get, pregnant women, in short. Whenever you come for the training, when we are doing the scans, we do them on real patients, or real models, let's say. So a number of male models, a number of female models. This is for the regular POCUS. For the OBS POCUS, there is OBS 2 and OBS 3, which is more commonly or easier to do. Then there's OBS 1, which is for the women who are in the first trimester. So who can do POCUS? Medical officers, clinical officers, nursing officers. We've also trained paramedics in POCUS. All it needs is just willing and ready attitude. You say, I want to learn this new skill. Let me see how it goes. Yes. So to answer that question, yes, we do OBS POCUS. But it's a different POCUS, not inclusive of cardiac ultrasound, lung ultrasound, vascular access, and FAST. So that one is that one, and then we have the OBS POCUS as well. All right, thanks so much, guys. Thank you for taking the time. See you in the next POCUS, which should be first, or rather next CME, which should be first week of February. In case you're interested in the POCUS that will be happening first week of February, you're also welcome to book, and you start the journey of POCUS. Otherwise, have a great afternoon and see you in the next one. Goodbye.